Well, good afternoon or good morning or even good evening, depending when you're viewing this. We are so excited to come from CommQuest Services in downtown Canton with a very unique opportunity to what I'll call a fireside chat. Even though we probably don't have a fire, we're actually practicing social distancing, so the distance of 6 feet will become the fire in the middle. And my name is Mike Gallina, and I'm a retired superintendent of the North Canton City Schools and currently the Vice President of Organizational Development and Community Outreach for Aultcare, your local health plan system. And today I get the very distinct honor and opportunity to be basically moderating a conversation with Keith Hochadel, the CEO of CommQuest. So we're glad you joined us. We're certainly excited about what we're going to share with you today. And I'm going to actually turn it over to Keith and let him introduce himself, just so you get to know that distance between us isn't so far, and we're excited to enjoy a great conversation as if we were side by side. So Keith, why don't you introduce yourself to the crowd today and tell them a little bit who you are.
Sure, thanks Mike. I appreciate you moderating the Fireside Chat. I did see the thing a couple weeks ago that in Florida it's an alligator's length. So I think that's appropriate also. So good afternoon, evening, morning. Keith Hochadel, President, CEO of CommQuest Services. We are just really privileged to have Mike with us today to have a little discussion, just to kind of provide some updates on what CommQuest is up to these days and kind of what normal feels like. I've been doing an internal video for our staff, our version of Governor DeWine's 2 p.m. press conference a few days a week. And we just thought this was a good way to kind of get something out to the public today or over the next few days that just kind of shares what's going on at CommQuest. And Mike was kind enough as a friend of our agency to be the moderator for that. So thank you, Mike. I appreciate it.
More than welcome. And you heard Keith talk about managing it similarly to how Governor DeWine would perhaps do a press conference, and trying to create that sense of normalcy in uncertainty. And it's great that you can hear your leader's voice. It is so important that time does not go by that you don't hear from your leader, even though it's uncertain. So Keith, I appreciate right out of the gate how you've managed to stay connected to your keeper of community and that mindset, but then also to just your staff generally. Heard that word normalcy.
Yes.
So I'm going to dive into that a little bit in our conversation and say, what's a normal day looking like now, given what we've been through the last 6 weeks?
Yeah, so interesting that we've been talking about a new normal, and when it was first announced that there was going to be some restrictions, and we tried to figure out, okay, how quickly can we get to being able to provide the same access to care that we've been recognized for. So immediately that transition was, how do we provide telehealth? How do we provide counseling either over the phone or through video counseling, not just for our individual sessions, but also for assessments, for our group sessions, for our medical programs? What were we going to do service-wise that was going to be the same still? So some of the face-to-face stuff or close to face-to-face that we had to do, and then how could we deploy our staff using good, safe means to continue to provide services. So normal to it today for us looks like all of our offices are still open. We're still taking new appointments. Individual counseling assessments groups are still taking place using either the telephone or through video counseling. Somebody comes out of the hospital that needs to see the psychiatrist or the psych nurse practitioners, they're coming to the office just like they did before. If somebody needs a new appointment or an injection, they're still coming to do that. Our methadone clinic, they're still seeing people face to face. Detox units are still accepting admissions, and residential facilities are still operating. We have the payee center, so we still have to help people pay their bills. So a lot of what we're doing is different, just practicing good health and safety through social distancing, through wearing masks, all of those things that we're instructed to do. But a lot of it, you still have to be there to provide those services. And as many of you probably watched this afternoon, as the governor is starting to release some of the restrictions. That's going to be another new normal for us.
What I think, Keith, is so awesome about what you just described was a lot of folks hear a change in what we're allowed to do in our world. But the world continues to move, and needs around substance abuse, detox, counseling, those things don't just stop.
No.
And many folks probably panicked initially to think, how will I get that service if I'm not allowed, even though it probably wasn't true that it wasn't allowable.
Right. So we spent a lot of time on the radio, putting stuff out on social media and our media platforms, letting people know that we are essential healthcare providers. So we may not be the hospitals and the stat cares and emergency rooms, but mental health and addiction recovery are essential needs for folks. People still needed those counseling services, still needed their medication, still needed to have access to care. And I think Lieutenant Governor Houston did a really nice job of saying that, hey, look, in a time of crisis, those things like depression, anxiety, substance use, they have a tendency to increase. And so we wanted to ensure that we were there for folks when they needed that help. That we truly, and you can see at our outpatient offices, we have signs out that say your mental health and recovery is essential. And to me, that was really important that we got that message out there.
Powerfully so, because you have folks who are typically in their pattern, if you will, of counseling or whatever their program is. Then you have those folks that are right on that edge or on that cusp of saying, you know, I'm managing this myself, but now this pandemic pushed me to a spot. Thank goodness CommQuest is here and has the opportunity to say, come on through and we are here for you on that essential level.
And our staff did a really good job of going through their caseloads and reaching out to people and saying, hey, we're still here. This is how we're going to do things. We started, as soon as we found out that there was going to be some restrictions, we started making phone calls to our appointments the following week and making sure that they understood that this is how we were going to contact with you. So as part of the safety, one of the nice parts about our women's residential programs is they're all single bedrooms. Our men's Wilson Hall program, they have dual occupancy rooms, but plenty of space to social distance. We were able to bring meals to people's rooms. Our detox units in Alliance Hospital and in Canton Altman, we went to single bedrooms. So it decreased capacity and unfortunately decreased some revenue. But on the other hand, that's a pretty good trade-off to make sure that people are safe. Not only the clients, but also our staff, because keeping our staff safe is paramount to me.
Well, you think about all the frontline worker conversations, and we see that so across the news. But folks will get lost in that a counselor is a frontline.
Yeah.
And how you're managing that in a space correctly that still lifts that particular person's care and the access to that still being maintained.
Right.
Powerful frontline story right here at CommQuest. And I hope our viewers and listeners, as they're picking this up, understand that it gets closer and closer to home the more you listen to Keith have his conversation around this. So Keith, would you say that the telehealth part was the most unique and creative given the system of care that you provide?
Yeah, it really was, Mike. So we've been doing telepsych, a little bit of that for a while, probably maybe a couple years. So we had some familiarity with it, but that doesn't mean that the counseling staff had that familiarity. We had a group of about 4 folks that sat for at least a couple hours trying to figure out how to do group counseling, not just for an hour of group, but a 3-hour group, and what that needed to look like so that we can continue to do that intensive outpatient programming. So it has, and we've discovered some things that we're going to continue to do because again, people can access that service from anywhere they're at. It's not just, now we only have one way to do it. Now we have multiple ways to reach folks. And again, I can't tell you there hadn't been a few bumps in the road from here and there. Some people that have certain types of phones only have so many minutes. Not everybody has video access on their phone. So fortunately, the states relaxed some of the rules and allowed us to do just telephone conversations for counseling. But again, the video or the telehealth has been by far the most unique thing that we've had to do. And, think of it this way, there's all the front end stuff that goes with it, like gathering people's insurance information to make sure we get paid for claims. How do we go about ensuring that who somebody says they are is who they are? So that there's been some challenges along the way as well.
As Keith shared challenges, it's unique in my seat, given my Aultcare hat, and you talked a little bit about health plans. And the unique thing about having a local health plan is that you're able to have the conversation with someone close by to say, how should we handle the telepsych? An example I can share would be how you code it so that it is reimbursed correctly. So on the Aultcare side, being here, Keith's group can call us and say, here's what we're experiencing. How do we manage that?
Yeah.
And having the ability of that being quickly done allows that to stay systematically correct.
And we've had great relationship with Aultcare for a considerable amount of time, and just being able to pick up the phone and talk to somebody directly as opposed to talking to a voicemail and waiting for somebody to get back to us has been really helpful. I have to say those relationships with folks like Aultcare and Buckeye and CareSource, where we actually can have that conversation and we're not waiting for emails to get back and forth. I'm a face-to-face, voice-to-voice person, and to me, that's extremely important. One of the other challenges, Mike, and I was thinking about this, is those kids that are in school that we're used to, when we're doing school-based counseling, mental health, prevention, consultation, those kids are right there in the building. And the teachers are like, yeah, it's time for you to go to your counseling appointment. So that was really easy. Well, when they're at home, one, they may not be getting up at 8:30 in the morning, like my kids aren't getting up at 8:30 in the morning. So I think the other challenge has been, while we encourage and have been flexible to allow people to work from home, there's that understanding of you may not be able to get a hold of those people first thing in the morning. It may be a late afternoon. Your workday schedule may change also into the early evenings and that. And it's we've had some really good success stories. Whether it's folks in our homeless shelter or people coming to the Friendship Center to get meals and that, or the Samaritan's Table, we've had a lot of really good success stories that have come about.
As I listen to you share, Keith, the power in it is how comprehensive your services are. I think folks miss that. They'll see CommQuest and they'll quickly think perhaps a detox or perhaps a telehealth on the psychiatry side. But all the other support services that come from the community base to that, perhaps dive a little deeper into that. You alluded to it beautifully. Sure. I think folks would really get a great appreciation and say, this is a great story.
So for 33 years, the Samaritan's Table has fed people on Thursdays at St. John's Church. Every single Thursday, except for Thanksgivings or if Christmas happens to be on that. And all of a sudden, we're in this stay at home. Those volunteers wanted to continue to provide those meals in some way, shape, or form, but we had to practice social distancing. We couldn't have too many people in the building at one time. So what they did is they developed a way to do to-go meals, where so people are still providing food. We're creating to-go meals. They're still able to go through the line and get the pantry items and the other items that are really important to them. So on a normal Thursday, we were at probably 350, 400 folks we were serving. The first week, we still served 250 folks. And again, a lot of those volunteers are, frankly, are older folks in the community that come all masked up and ready to volunteer their time. So that's been pretty cool. The Canton Friendship Center, which is a social center for those folks, drop-in center for those folks that are struggling with mental health and just need some place to socially have conversation. We couldn't possibly keep social distancing there, but they still needed that place to come and talk. So what we opted to do was to do meals every day for them. So people drop off food and we combine them and make carryouts. But we also have a food pantry there. So they can come through the food pantry, they can get their meals, they can still interact with each other just by practicing good social distancing. And then in the same building is the Payee Center, where we're assisting people in making sure their bills are getting paid. So in some cases they have to come in, and so we restricted the hours somewhat to a couple hours on Monday, Wednesday, and Friday. But they're still coming in there; they're still getting what they want. Which to me is extremely helpful because people need some sense of normalcy in their life. And then lastly, as far as a couple other things around social services, we have a homeless shelter, the Family Living Center over in Massillon, that's operated for a number of years. And people still are finding themselves homeless, and they still need to make that transition into permanent supportive housing. So over the last month, we've been able to place 3 families through the good work of our case manager over there, and Amy and Ruth and Mary, the case manager. We still had to place people and help them work through the paperwork that's necessary for them to get placed. And then, to me, the heroes in all of this are our folks that are still doing the face-to-face stuff. It's our nurses in the methadone clinic. It's our residential staff. It's the CPST workers that are out taking people to their appointments that are still going on. They're the ones that are still having the most closer contact, still again doing the best we can to practice social distancing, but they're committed to providing the services that they need to provide. And yes, people still think about the mental health and the addiction stuff, but those other those other ancillary services and all of the support folks that go around that, whether it's marketing or our support staff or our finance staff, our HR folks, all of us have been involved in this day after day after day.
If you're trying to give a sense of meaningfulness and
Yes.
purpose to it while you're managing the choppy water of the systematic change that we
Yes.
were all experiencing. I think our listeners and viewers, maybe a point to back up to that I think is powerful. Community services and Quest Recovery merged several years ago, and that's a comprehensive nature of services.
Yes.
Keith and his team did a beautiful job through their board leadership and their strategic planning to wrap their arms around this to say, how do we lift both up in a way that's comprehensive? Then to be challenged with a pandemic, it really pushes the ability to say how powerful those services are. So Keith, I give really applause, appreciation, and admiration, all 3 of those words, because you were challenged against that model in this current time and are delivering, as our viewers and listeners have heard, on so many levels.
It's interesting, Mike, because the origination of the legacy organization was the result of the flu pandemic in 1918.
How about that
1919.
full circle?
And now we're reliving some of that without some of the consequences that occurred 100 years ago. But we just celebrated 100 years,
Okay.
and we rolled into this year, and now we have the what amounts to the second pandemic. So it's interesting that those are the bookends of what we've seen. And again, neither organization needed to merge when we did. We did it because access to care was really, really important. And to me, being able to provide services so that people don't have to call multiple places, so they can walk in or call and get everything that they need in one place, is really important right now, because this has converged on every part of people's lives. This isn't just this group of people over here, this group of people over here. It's everybody, all day, every day. And my guess is the viewers for Governor DeWine's 2 p.m. press conference today was probably twice or 3 times what normal is, because people want to know what they're going to be able to do again, and they want to know when they're going to be able to do it again. And there's some things that we know we're not going to have. We know we're not going to have in-class school the rest of the year. And I've got 2 little kids at home, so we're working through that. My older son's getting married in September, so he's wondering what that's going to look like in September, even though that seems like a long ways away. It's really not.
For planning,
right? Right. So, what's it look like to hospitals? What's it look like? How long are some of the code sets for the telehealth billing going to be in place, and the telephone billing going to be in place? Some people have gotten really comfortable with that. We're putting together our transition plan as we speak. And so what's that look like? How do we continue to provide a safe space for clients and most importantly for staff as well.
It's a beautiful summary because it won't be just we're going to open the door and be back at it like we were, because we've learned some things.
Yes.
And we want to make sure that we can keep delivering. I love how you come back to, okay, if we have to do it telephonically or at least through video conferencing, what's that look like? But it might be the best way for folks. So it could be a retention as well as a growth potential.
Yep.
And then the insurance folks have to make sure that they keep up with that, to say, okay, that's a good resource to folks. How do we make sure we stay in that game, rating it correctly, and then managing it? Interesting point about Aultcare, that's things that we've learned. We had about 550 employees total. We have 96% of those working from home now.
Yeah.
And probably half of those will come back because we've learned we can do some things.
Mm-hmm.
So the opportunity for folks to work from home might be a retention or an opportunity for employment.
Right.
Someone might want that. But then the unique way of delivering service becomes more agile. So each organization learns a lot as it moves its way through this.
Yeah.
And so Keith, you described how that you hope to continue it. And in each company's own way, they're going to find out beginning today, what's that phase look like?
Right.
And then how do we come back and say, this is how we want to be?
I do think there are opportunities to redesign your organization.
Mm-hmm.
Sometimes people think about, okay, we'd like to do this, we'd like to do this. It probably takes us this many people to do it, and then all of a sudden you have a crisis like this, some extreme circumstances that we're in, and we find out that, you know what, this person maybe does this better from home than they do from the office, or we can direct folks where we need them to go a little bit easier now. And there's going to be some people that come out of this, Mike, that just say, you know what, I much prefer this model of delivering services. And so we don't know exactly what it's going to mean, but we do know that there's going to be some opportunities to redesign some processes and systems that will make us more efficient and more effective. And there's also going to be some things where we've underperformed before and underperform now that we really have to take a look at and say, okay, how do we make this better? Where did we go wrong? But more importantly, the passion of the staff that we have and what you've described at Aultcare, the passion to help people has not gone away at all. People still want to help. They just found different ways to be able to provide that help.
For sure. Try these words on and see if they make sense to you, Keith. I've sensed this idea of an inspired purpose.
Yes.
And what I mean by that is you have your delivery, your mission, it's what you're here to do. But there's been an inspired purpose of how to do that.
Yes.
And you allude to a big heart of your staff. Why don't you talk a little bit about that? Because I can really tell that's important to you.
Yeah, it is. We have a tremendous group of people that provide service for us. And it doesn't matter what they're doing. They are committed to getting here or getting in front of their clients in any way that they can. And what they've seen is that they're making a difference in people's lives, no matter what the circumstance, in some really, really extreme circumstances. Imagine somebody going into a homeless shelter and not knowing whether or not, how long they're going to be there, having a couple kids and saying, you know, we may be here for a while, and somebody with a passion to help them found them permanent supportive housing because they worked just a little harder and made some other people work just a little harder to get that done. Those people that we had a gentleman last week that got a stimulus check and knew that he wasn't really ready to leave our men's residential program. And the staff talking him through the fact that, look, you're probably not ready to go. I understand that you have this check out here waiting for you, but what have you done when you've had money in the past? And being able to talk them through why it was important for them to stay, and at the same time being able to protect that money so that nobody else that might have had access to it took it, so they could find a little better place to live when they got out. Our CPST people, just putting people in their car and driving them to their psychiatric appointment so they can get their injection, so that they can maintain positive mental health. The guy that called me, like, it probably wasn't 5 days into this, that was so upset because he couldn't go to his AA meeting because they barred the doors. And just talking through, hey, look, would you like us to put a support group together for you so you can talk to some people? And the ability to do that, the ability to make the suggestion to him that says, why don't you just invite 4 or 5 of your friends to have a fire out and back? There's going to be less than 10 of you. There's going to be a couple of you. You can practice social distancing. You're not going to be in violation of anything. And frankly, it's going to be kind of a nice night when he called me. And it's things like that, but our folks that come to work every day and they're either in the office or they're on the phone trying to make a difference, and they're trying different stuff, and they're telling their clients, hey, look, we're going to try Zoom today, or we're going to try Teams today, or we're going to try Google Hangout today. And then just seeing that result and having a board of directors that supports us, having a local mental health and recovery board that supports us, having a hospital system that supports us, or 2 hospital systems that supports us, and have insurance providers like Aultcare and CareSource and Buckeye that support us. Those are the things that you've heard me talk enough times that I believe in this. This community moves toward solutions, and part of the reason why Stark County will come out of this better is because this community moves toward solutions. And I'm just so proud of our organization and the relationships we have with folks like you, Mike, that I know that we'll come out of this better on the other side because of that.
So powerful. They talk about hope is the dream of a soul that's awake.
Yep.
And boy, when you can powerfully energize a soulful attack to something, that inspired purpose, the way your staff does, it's amazing. So sometimes we'll say it was impossible, but unbundle that word to say, I am possible.
Yes.
It's crazy cool when they start to say, around that fire, we made that possible.
Yeah. And there's a reason why our mission statement is hope happens here, because it does.
But it takes good leadership, Keith. I hope folks get that through the vibe. The leadership team that you've put together that I know so well, caring people who just happen to be working with you at that core delivery model. It's who it is, then what it is you're about to do with them. I know our time's going to get a little bit short here, but I want to tap on just a couple things. I would say as we move through this, what would you say that you've learned about your organization? Could be a lesson to some other organizations. That's why I asked.
So much I've learned. It just reaffirmed the heart and the passion they have, not only to help clients, but to inspire each other, to help each other move forward, to offer that encouragement, to pick up the phone and say, hey, did you try this? Or, hey, can I share a little bit about this? Because, you think of the amount of time that you spend with the people you work with, and all of a sudden, somebody's working from home, somebody's working in the office, where you don't have that. They have connected with each other so well. So I think one of the things that just reaffirmed is that how well people work together. And I think the other part is that, every part of this community plays a role in the success of how we move forward. And last week, Denny Saunier at the Chamber had the hospital folks come together. Mike, think about it this way. 5 years ago, do you think Altman and Mercy would have been on the same video?
Hey, how about that? Yeah, anybody knows that history would say, no, that isn't happening.
And I think that, we look at it as, we're in this together, all of us. And we all play a key part in it. And I think that, to me, we're going to be a better community in spite of this. But we're going to be a better community because we're encouraging of each other. And we just want to play our part in that. That's all.
Yeah, it's pretty cool. I love how you take that idea of not so much what we've learned, but what's been reinforced. And when you summarize that, it usually comes down to that relationship upon relationship. Leads me to this thought around the word discipline, how we discipline ourselves coming forward. That word discipline actually comes from the word disciple, which means who or what you follow. It doesn't have to be church, but it can be. Mm-hmm. But when you think about a community, and let's use Stark County, who or what we've followed with one another has created that discipline that is so cool that will allow us, I think, quicker to rise because we've energized it from the right spot.
And we all have it. We all have our ministry. Whether ours is addiction or mental health or whatever it is, we all have that. We all have that gifted area within our organization. We all have gifts within ourselves, and those gifts that people have really shined. And this does give us an opportunity to to lean on people in areas that they're more gifted than maybe we thought. So we've learned a lot about our organization. We've learned a lot about the people that work with us. We've learned a lot about the community, and all of those are lessons that we can move forward and make it better.
Boy, for sure, you think of that word, you have people, organizations, and then community. And that community sense starts to show up as each of those bump into one another. It's this almost an equation energy that you have synergy at the end of it.
Yep.
1, 2, 3 equals a lot more than what that typical answer would be.
Sure does.
That's awesome.
Yep.
Maybe I'll share this because you're such a powerful leader, and I want folks to get that. Keith, you've done so many cool things through that transition of putting it together. I say CommQuest, but then how you deliver services across this community anyway. So perhaps from a great leader, I'm going to ask you an open-ended question. And folks, he doesn't know this one's coming, but it's not a hard question. But I love it when folks will share from their heart the answer to this question. And here it's open-ended. Good leadership exists when, and you fill in the blank. Good leadership exists when, and you fill in the blank.
Good leadership exists when you have great people working on your team. Chris Carter said something one time when he came and spoke to us, Chris Carter from the Hall of Fame. He said, "Why settle for good when great lives right next door?" Organizations and leadership really comes on the people that are working with you. Not for you, but with you. And to me, I've got the greatest group of people.
It's awesome. Heard Keith talk about people before you go to process. But it would be fun for me to say good leadership exists when you have Keith Hochadel and CommQuest around communities. So it's my way of coming right back around the block to say, thanks for what you're doing, Keith, for sure. It's been a joy for me to be with you. Is there anything else you'd want to tell our viewing and listening audience today as we close?
I think the one thing that we just continue to tell our staff is, we all do better when we know what's going to happen next. And that's been part of this challenge is we don't know. Even with things opening up, we still don't know. So I just ask that we continue to be kind, we continue to practice grace and kindness with each other and with our community, and we move forward together to make this better.
Yep, I love those words, peace, kindness, those things ground us to then allow us to have our best skills and talents in the game. So Keith summarized well. If you're just closing out with us, I'm Mike Gallina, VP from Aultcare, and I've been spending time with Keith Hochadel, the CEO of CommQuest, and we've had a great conversation. If you got in late, make sure you dial all the way back. It was a joy to spend some time with Keith, but most importantly, it was a joy to lift up a community organization like CommQuest that has been so helpful, not only through this pandemic, but through years, and we're certainly excited about what they'll continue to do as we move just beyond this to the other side of COVID-19. Thanks again for joining us.